everyone. Happy Friday. It's Casual Friday around here. We always enjoy Fridays a little bit more. So I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our daily update of the impact of the COVID-19 epidemic on Mobile County residents. And we have other topics to discuss today, so I'm just going to go straight to the Mobile County data. I want to remind people, I spoke yesterday about the fragility of the surveillance system that Alabama and other states use to collect disease information and share it with other partners, including CDC. There have been some difficulties with stabilizing that system, and CDC is working with the states and the vendor to try to get that uprighted. But we know that there have been delays this week, great delays in our ability to investigate cases, and that is resulting in a lower number of cases than we think is actually happening out there. We're hoping to get that cleared up or CDC's hoping to get that cleared up this weekend, and we'll let you know more about that next week. But today we were reporting on 2,352 cases of COVID-19 disease. 99.5%, or all but 11 of those, were laboratory confirmed, so 2,341 laboratory confirmed, and our probable case count is 11 today. 248, or around 10.5% of those have been hospitalized at some time during their infection, and 123, or 5.2%, have died from COVID illness. Yesterday, we added 22 cases of COVID disease to our case count. So we'll talk more again on Monday. We'll update the weekly information and also give you an update on how they're doing to correct the surveillance system. So let me answer a couple of questions before I turn it over to some other people here. Let's see what steps are being taken to ensure that hospitals are well supplied during a hurricane, and does COVID-19 present any special challenges? Of course. Anytime you have a disaster within the disaster, it just makes doing business that much harder. But as with all disasters or natural events, man-made, the hospitals are prepared and they exercise for these sorts of things. And our emergency management agency colleague and our emergency preparedness coordinator may be able to speak to that in just a sec. So let's see, something COVID related. Does MCHD get copied on all lab results performed in Mobile County, nursing homes, private labs, or just have the figures on the tests that we're doing? So Mobile County Health Department is not performing any COVID laboratory tests. We draw the specimens here, but we send those to the state lab or to a commercial lab to get tested. So all of the test results that go into the state of Alabama surveillance system for COVID-19 disease are shared in near real time with the health department, with our case investigators then. So yes, we have the ability to see those in the statewide system that's run out of Montgomery. Let's see, when will hospital visitation open? And someone, I guess, on Facebook said that Governor Ivey issued the no visitors executive order, and it doesn't expire until June 3rd. So, we'll learn probably next week or in the next couple of weeks if she's going to extend that order. So no, I've had to explain this several times that no visitation is still the state directive for all healthcare facilities, all nursing homes, assisted living, and specialty care. Someone from Facebook said, I have to go to Providence on the 17th. Will it be safe? Well, right now we're telling folks that if you can, stay out of healthcare settings, that's best. But if you must go to the hospital for a surgery or some procedure or some sort of test, definitely take precautions. Most facilities are still screening anyone who comes into their facilities, but wear a face covering, keep your hands out of your face and your face, cover your cough, sanitize your hands, stay 6 feet away from people to the extent possible. And if you're concerned about it, you can always ask your providers to hey, did you wash your hands before you're starting this procedure, that sort of thing. And then someone made a comment that the new dashboard has more features, but it's not as easy to navigate. I think that is in reference to the Alabama Department of Public Health dashboard that was revamped over the weekend and has a different look and feel. Some people like it, others are having a little bit more trouble. So again, they're just trying to show as much information as they can, and we are almost never able to please everyone. So hopefully other folks are continuing to find it useful. I wanted just to make a note that today the Centers for Medicare and Medicaid Services, CMS, began releasing facility level data for nursing homes. That is available publicly now. So all of you who had been asking me the names of the nursing homes that have had outbreaks and how many they had, and I said that we're not authorized to release that data. CMS is now releasing it. They are the governing authority on that. So you can find that on their website. And on Facebook. Okay, thank you. I get a lot of questions about, or a lot of calls, a lot of questions about reports of COVID positive employees. And I wanted just to share a couple of remarks on that. So, we get someone at my work tested positive, and, what do I do? Aren't we supposed to shut down? My employer, isn't he obligated to, or she obligated to tell me about it? We get these all the time, and honestly, many of them are false. You probably are not surprised that some people just have decided to cause trouble, and they will tell people that they're COVID positive when they're not. So what we try to do when we hear about those reports is, first we try to verify it, and we investigate all COVID patients and identify their close contacts following the guidance that's been issued by CDC and ADPH. So when we hear about a positive patient, we contact them and we ask them about their contacts. Were you at work? Were you at church? Were you at a restaurant? Those sorts of things. And we find out who was within 6 feet for 15 minutes or longer of them during a formula a couple of days before they first had symptoms, through the time that they are isolated. And if they were PCR positive without symptoms, then we go back a little bit further to try to ask them who they've been around. Then the health department contacts the contacts. So if you have been named or identified as a contact to a laboratory positive COVID-19 patient, the Mobile County Health Department will attempt to reach you to talk to you about that exposure. So if we don't call you, it probably means that you did not fit the definition of a contact according to CDC or ADPH. So per the HIPAA privacy rule, we don't traditionally contact employers and let them know that that they have, a worker that may have tested positive. Sometimes we might need to, if we're not able to verify that a person worked at a fast food restaurant on a particular day, or if the employee was not sure who else they were working around that day. But we don't always do that. It's not required by law, and usually we will only do it if there is an overwhelming public health need to do that, and that happens rarely. If we identify a cluster of cases associated with any facility, a restaurant, a workplace, a daycare, a church, a healthcare setting, then we contact the business owner to discuss that setting and the transmission going on. And a cluster just means you have 2 or 3 cases tied to a specific location during a short period of time that might indicate a problem with transmission in that facility. And businesses, last thing I want to mention, then I'm going to stop belaboring and move on. Businesses are not required to close their business if they have a COVID positive employee. There's very clear guidance from CDC about closing off an employee area, disinfecting it, letting it, like a cubicle or an office, letting it sit for at least 24 hours before reopening it. So if a workplace has a positive employee, it's not a mandatory requirement that they close. So if any businesses want help talking about this, then give us a call. We're happy to chat with you about it. and walk you through what you need to do if you have someone at your workplace that's tested COVID positive. All right, and I think I'm going to stop there because I got a whole stack of things left, and there are other people here to provide you with some helpful information today. So I am going to step off the riser and let Erin Coker, our Emergency Preparedness Coordinator and Healthcare Coalition Coordinator, speak to you about hurricane preparedness in context of the COVID pandemic.
Hello everyone, I'm Erin Coker. I'm the Emergency Preparedness Coordinator for Mobile County. I brought Glenn Brandon with me, who's the Director of Plans and Operations for the Mobile County Emergency Management Agency also, and he's going to step up after I'm finished and just kind of give you a little bit more information about some helpful tools that are out there. So this hurricane season, we are really pushing everyone to have a personal plan that does not include shelters. Shelters should be used as a last resort this year. We are really encouraging those, especially that have underlying health conditions or that are 60 and older, to utilize alternate plans. The shelters are going to be a very high risk area for contracting COVID-19, so please look at personal plans, look at going inland further, visiting family, staying with a neighbor if you have to, and if you are neighbors with an elderly resident, please check on them daily during this hurricane season. So along with Red Cross, EMA, the health department, the school system, and Department of Human Resources, we have been working with them to look at all of what we call our mass care shelters, which are just large general population shelters. Of course, this year we have to implement social distancing, so that means that we're going to have to look at more facilities to open. In those areas, we've encouraged Red Cross to implement a 60 and older area to isolate them away from the general population, and then also to have a sick area for anybody that knows they've been exposed or maybe having symptoms. Then for the medical needs shelter, which is a shelter of last resort for patients that may need minor medical oversight or power from the facility, we also have implemented a 60 and older area or a high risk area, a COVID area that has 4 rooms with the restroom separated from everybody else, and then we'll have our general population area. One of the main criteria to be admitted to a medical needs shelter is that you have to have a caregiver that's 18 years of age or older. We do provide medical staff, but there's very minimal medical staff there and just in case of an emergency. One of the other criteria for being admitted this year is you have to bring a mask. If you don't have a mask, we will try to provide you one, but we are highly encouraging everybody to bring a mask. It can be a cloth mask, it can be just a general mask that gets thrown away. We will be putting our staff away from patients this year as well, so they'll be in a completely different area. In order to be admitted, you will be triaged. You'll be asked some COVID-19 questions about exposure, and you also have a temperature check before you're even admitted. And then of course, we always encourage you to bring all the supplies that you would need for 72 hours. So if you have special diets or wound care or something along those lines, please bring that with you. And then the other thing that's changing this year is you will not be able to eat in the cafeteria at any of the shelters. We can't have anybody congregating together, so we will dispense the food to you and you'll have to eat in the area that you're assigned. And then of course, we always encourage our Get 10 Go bags. So that's 10 essential items that you may need if you have to evacuate. So your medications, money, flashlights with batteries, hygiene kits, first aid kits, hand sanitizer, weather radios or some way to receive weather alerts, canned goods, can opener, and then water and snacks. And of course, this year it may be get 11 and add a mask to it. So that's all I have for right now. I'm going to let Glenn Brandon come up and speak to you about a few things, and thank you for your time.
Afternoon, everyone. I'm Glenn Brandon with Mobile County Emergency Management and one of the plans and operations guys. Erin has pretty much covered everything as far as sheltering. Like she said, we've been working with our partners, our shelter partners, over this week to make sure that we have everything in place. Anytime we have tropical activity, there are a lot of questions that are asked. I would like to direct you toward, an app that we have that's the Mobile County Emergency Management Agency app. It's a really good source of information. It has our social media, it has alerts, a lot of information about us, contact information, any relevant news, your preparation requirements, emergency plans. It also will designate the shelters that will be open and when they'll be open, and also points of distribution if we have to open them after a storm. There's also evacuation information, and a really unique aspect of it, there's a Where Am I section you can click on, and it will give you an exact location, and you can share that with other people so that you don't have a problem, or if you get lost, or if you're not sure where you are. It's a really good app. You can access it through your app store, either through the iPhone or the Android system, so either one. But everybody just be safe. As Aaron said, make sure you have a plan. Our sheltering capacity is somewhat limited due to social distancing. So just have a plan and be prepared to act on it if you need to. Thanks.
Good afternoon, everybody. I'm going to wrap up today's, I'm going to wrap up today's news conference with a little information about the Mobile County WIC program. My name is Amanda Arnold. I'm the director of the WIC program here in Mobile County. I know y'all have been bearing with us as we have totally changed the way we've done things in WIC. So we are going to continue our phone issuance through the end of June. That's what we've been authorized to do. So if you need an appointment, have an appointment, please just call your clinic, your general clinic number, and the staff will talk you through that. If you do have to send us proof of your residency, of your income, of yourself, or send a picture of your ID, you can do that at our email address. It's wicmchd@mchd.org. And just a reminder to be patient with us, because there's a lot of you calling at the same time. So be patient, because we're there to help you. We're trying to see everybody that we can. I say see. We're trying to talk to everybody that we can. If you do have a special formula that is a prescribed formula from a doctor, and you need to pick that up, that can be done at our Teen Center location, which is at 248 Cox Street. That's going to be across the street from Children's and Women's. If you go to that clinic, they know what to do, and they can get your formula for you. And just a quick thing, a new exciting thing that we found out about earlier this week is that the National WIC Association has partnered with Noggin to make their learning app available for WIC families for 90 days. So this is a great way for our participants and their children to have access to developmentally appropriate books and games and songs and other engaging content for preschoolers. It's designed in kind of in the same pathway that Early Head Start Learning Outcomes Framework is what they're calling it, and it's designed by a child development specialist. So if you're a WIC family and have interest in this, it is available to you. It's just an interactive learning service from Nickelodeon. This is what it says. With Noggin, learning is led by Nickelodeon preschool characters that your kids already know and love, and is developed by experts in education. It offers an ever-expanding library of books, learning games, activities, and episodes of your favorites like Paw Patrol, Peppa Pig, and Blue's Clues. So if you're a WIC participant and you are striving for things to keep your kids engaged this summer, especially with our lack of being able to go places, the National WIC Association is going to give you access to the Noggin app for the next 3 months. So we look forward to seeing y'all back next Monday. Have a great weekend. Stay dry. Stay safe. You want to say something? Yeah. Okay. Sorry, we have one more speaker. I apologize. I thought I was last. Y'all have a great weekend. Thanks. Sorry.
Tangled up here. Sorry, hey, I'm Mark Bryant, the Public Information Officer for the Health Department. It was just one last thing. Because of the expected weather problems on Monday because of Cristobal, we are suspending our COVID-19 testing on Monday. Most of the tests are done outside of our facilities. So it's just, the chance of rain and wind, we're going to cancel that on Monday. We'll be back on Tuesday. So, but every other department will be open on Monday as usual. So we'll be back here at 2:30 on Monday afternoon. Again, thank you for watching, and we'll see you next week. Stay safe.